Good morning and welcome to another episode of the MDI Prep Show. I am your host, Dr. Anthony Sutton. And in the studio today, we have two wonderful guests. We'll let them introduce themselves.
Good morning. My name is Renee Stewart, formerly Sutton.
Okay, talk up, Renee. Don't be scared. All right. And who else do we have?
Good morning. My name is Madison Corcoran.
Well, thank you all both for coming, and we're going to be talking to them. They are getting ready for their exam on this week, and the exam that they're preparing for is what?
The NCLEX, RN.
For RN. Awesome. So before we get started, we always want to send a shout out to those who have supported MDI Prep. And so this morning, we want to send a shout out to Dr. Kevin Smith, ENT plastic surgeon here in Houston, Texas. So just take a listen.
Dr. Kevin Smith, founder of the Smith Center, has continued to provide a perfect blend of care and transformation to residents of the greater Houston area. Dr. Smith is a board-certified plastic surgeon, a fellow of the American College of Surgeons, and has worked in the medical field for more than 3 decades. His work in the areas of rhinoplasty, facelifts, and eyelid surgery has placed his name among the country's most innovative doctors. He has performed thousands of facial plastic surgeries, helping patients become more beautiful and more confident in their everyday lives. His insight regarding the connection between rhinoplasty and migraine headaches has brought more than 3,000 patients from all over the country to his door. Providing his patients with an 88% cure rate sparked him to author his breakthrough book, The Migraine Imposter. The Smith Center, located in Houston's renowned River Oaks, only minutes from downtown and the Galleria, houses its own state-of-the-art surgery center for cosmetic surgery, ear, nose, and throat procedures, and migraine treatment. Contact the Smith Center today to schedule your appointment and free consultation. Dr. Kevin Smith, founder.
That is Dr. Kevin Smith. All right, so we're in the studio. So we're going to hear about this NCLEX. All right, so talk to us a little bit about the NCLEX. Well, first of all, tell us a little bit about, Renee, tell us why you decided to go into nursing. Like, what was your motivation for going into nursing?
So originally when I started college, my major was education.
Okay.
And I thought I wanted to be a teacher until I started working at a preschool and decided that I didn't really like children that much.
Wait a minute. And correct me if I'm wrong. Don't you have 2 kids?
I didn't like children other than my own.
Okay.
So
all right.
I was like, yeah, this isn't for me. So I got a job after that at this assisted living care facility. And I started working with the older population and realized that I wanted to help people, and this was the way that I wanted to help them.
Oh, that's great. Okay, Maddie, could you tell us a little bit about your motivation for wanting to go into nursing?
Okay, so mine is actually the opposite of Renee. I loved kids, and after being hospitalized for a minor thing when I was younger, I was like, okay, these nurses are pretty cool.
Okay.
I was like, I want to do the same thing that they did, which was help me. And so I was like, I want to do pediatric nursing. And so I got into nursing. Got around pediatrics, decided that was not what I wanted to do, but that I still loved nursing for the same reason, helping people.
Awesome. And so you all have recently graduated from Lamar University Nursing School.
Yes.
Which is an outstanding program. I actually graduated from, my undergrad was from Lamar University, so I know the curriculum there is pretty rigorous.
Yes.
And so now you're getting prepared, you're getting ready. So tell us a little bit about, because there's some nursing or people out there interested in going into nursing school. So tell us a kind of a little bit about your roadmap, your kind of your GPS on how you got there. So Maddie, go ahead.
Okay, so right out of high school, I did decide to go to Lamar because it was close to home, close by my parents. So I went to Lamar and I took my 2 years of prereqs there. That's your basic courses, English, math, that kind of stuff. Was accepted into the program. You apply, and then I was accepted, thankfully, my first time. So then you have 2 years of nursing-specific classes, and that's when you're just in your nursing core classes.
Okay.
And then 2 years later, graduated.
Awesome. Is that pretty much the same road that you traveled, Renee?
No, I took the scenic route. So,
All right, you
So,
took the scenic route. Okay.
I did.
All
So,
right.
of course, I did the 2 years of prereq. 2 years of prereqs, getting back at Lamar after leaving U of H out here, and I went to Lamar. Did the 2 years of prereqs. You can take 3 out of your 4 sciences before you apply. You don't have to take all 4. You take 3 out of 4. You want your GPA to be at least I think a 3.0 for sciences average.
Okay.
And you have to take a HESI entrance exam.
Okay, the HESI. Okay, so for everybody out there, all you nursing students who are thinking, so you have to take the HESI. And how many questions are actually on the HESI? Do you all remember? I know it's been a long time for you all.
That was a long time
I don't
ago.
remember, but I do remember that the sections were like English and reading,
Okay.
math, and the sciences were broken up into AMP1, AMP2, Chem, and I believe maybe some bio.
Gotcha.
Because I scored the highest on Chem and the lowest on AMP.
Wow. So all of this is even before you actually get accepted into
Yes.
nursing school.
Yes.
And from what I hear, Lamar University is pretty competitive in terms of getting into that program. So how many people do they accept each year into Lamar's program?
So we were actually the biggest class that they had accepted in a while, and they accepted, starting off first semester, we had 88 students.
Okay.
That semester, they had over 200 apply.
Wow.
So
okay.
they're accepting more and more as their faculty and clinical opportunities open up, but they range about 80.
About 80. Okay. Now, question. So like for us, like in medical school, we may have started off with 220, but we didn't finish with 220.
Mm-hmm.
Is it a similar dynamic in nursing school? Like you all start off with, you said 88? How many did you finish with?
So
Of our originals, I
Yes.
think it was in the 40s.
it was half of our original.
Wow. Half the class.
Mhm.
Wow. Isn't that interesting?
Yes.
So that's pretty good. It's almost like, I always say it's similar to pledging online. Like when we were online pledging, you may start with some and not everybody finishes, because
Right.
of, the rigor. So getting into that, so did you have, in terms of the studying,
Yes.
like during nursing school, did you find it different than studying from undergrad?
Definitely.
Okay.
I would call myself like a last minute person. I study off of what are those? It was like 4 different ones, and I kind of study off of fear. Like fear motivates me to pass. So
Oh my goodness.
when I realize that I have 48 hours before a test, then I get into grind mode. Which
Right.
is not good, but that's me.
Okay.
So when I got into nursing school, I had that mentality like, 48 hours, I can do this. Well, no, not in
Right.
48 hours. You can't do it. Like it's intense studying.
Okay. So was it still fear mode?
Oh, I'm fearing fearful all the time.
All right. What about you? Was it undergrad and nursing school the same for you, or?
So, no, mine was very different, too. I definitely was in shock, I think, when I got nursing school, because prior, it was even a joke in my family, like, are you even in college? Because I'd come home, never bring my book bag in.
Right.
Never really went to the library, just kind of, before the test, a day before, like Renee said, skim my notes that the professor had given and take it.
Okay.
Nursing school was a whole different story. They were like, are you okay? Then I wasn't home anymore. I was at the library, and actual studying was different. Before, I'd study on my own, maybe skim the notes. In nursing, you got to break it down. I was lucky to find my good study partner. And so your whole method changes. It's very different.
And that's interesting when you mention study partners. It's important to really have that support system and everything. So how did you all meet? How did you all actually become study partners? And before you tell me that kind of give everybody a little bit about your background, like where you grew up and where you went to school, just a little bit to kind of know about how you all came together.
So I grew up in Beaumont, Texas. I went to elementary, middle school, high school there. When I became about 18 or 19, I moved to Houston and started at U of H. And then I went back to Lamar to finish nursing or start nursing school.
Okay.
I grew up originally in Beaumont for elementary school, and then moved to Lumberton, which is right outside of Beaumont, for the rest of my grade school education.
Okay.
And then went to Lamar right after graduation.
All right. And then how did you all come together to become study partners?
So, in nursing school, they assign you your clinical group. And in our school, I know some are bigger, some are smaller. Our first group had, I think, 8 or 9 people in it, 9 people.
Okay.
and we were in that group together. So you go, first off, you're scared to death because it's first semester of nursing school. You don't know what to expect.
All right.
And then you're in a group, in a room with 88 strangers.
Right.
And so they put you in this smaller group, and you naturally grow closer to your small group because you see them numerous times a week. And I don't really know how we started studying together. We just...
Well, I can, because we're so close now, so I can tell you. I probably told you this before.
Well, so we're getting an exclusive right
So,
now.
Of course, I'm that mom, and I'm very observant. Like, I see, and I come in, I'm like, look at these kids. That's what I would think instantly in my head, like, look at the kids. So I remember my first impression of everybody, and when I first met Maddie, I was like, how am I over here so nervous and she's so calm? During the whole orientation, Maddie was sitting there filing her fingernails.
Oh my goodness.
Yeah.
Okay.
While I was sitting there, I was like taking notes, like, okay, so we have to do this. Maddie was just sitting over there filing her fingernails. And in my head, I was like, I wonder if she's going to last long.
Wait a minute. So you didn't know. So you were thinking, wait a minute, she may be one of the 40 that's not going to make
I'm
it.
like, she's not serious.
She was weeding me out.
Oh my goodness. Maddie, did you know this?
No, not at all.
Wow. So that's very
You
interesting.
forgot about filing your fingernails. Huh?
I did until you said that. I sure did. I filed my fingernails that whole orientation.
Oh my goodness. Okay. So what about Maddie then? Because, what drew you to her to say, okay, well, we need to study?
I don't know. I think we just started like sitting together in class after clinical groups and stuff. We would sit together.
Right.
And I think everybody naturally like oriented to who they felt comfortable with.
Right.
Me and Maddie just clicked because I wasn't young.
Right.
Like I wasn't like partying and stuff or going to like, different things. I had a family.
Right.
And Maddie, although she didn't have a family, like she has an old spirit.
Oh.
So,
Oh my goodness.
Yeah.
So you filing your nails, Maddie. You got an old spirit.
Hey, yeah.
Okay, I got it. So it sounds like a little yin and yang.
Yeah.
So it's kind of like Maddie is that calming spirit, and Renee is more that like on the edge, or but that's a good balance.
Yeah.
So and you need that in nursing school.
Yeah,
So
she was definitely my balance because like there would be days that either I'm freaking out and she's like, "Oh, you got this," or vice versa. That I'm like so cool and she's like, "Hey, you need to kick it into gear."
but that's good though. That's really good. And so now we bring this full circle, and now we're here at the point where now you're getting ready for your NCLEX.
Right.
And so tell us a little bit about the NCLEX and how you're preparing for that NCLEX. In addition to, of course, now let me just throw a little caveat in here. So both of them have come down to Houston, Texas to and basically have kidnapped me. And they told me that I was going to help them with this NCLEX, whether I wanted to or not.
Yeah.
And so they literally have moved in. I'm cooking breakfast. Well, I fixed smoothies this morning for them. But tea, right, exactly. So we'll talk about that in another show. But we're helping them to get ready. MDI Prep is helping them to get ready for this NCLEX. So tell us a little bit about how you all started studying for this NCLEX, what you're doing to prepare, and that kind of thing.
Okay, so the first thing that we did was we went to a mandatory Hearst review.
Okay.
And that's a 3-day intensive lecture. It starts at about 8 a.m. and it goes about till 5 p.m.
Okay.
And it's basically a breakdown of everything we learned in nursing school in 3 days.
In 3 days?
In 3 days.
Wow. And it goes from 8 a.m. to what time?
To about 5 p.m., about 4 or 5.
That's intense.
Yes.
And it's called the Hearst Review.
The Hearst Review.
Okay,
yes.
gotcha.
So we did 3 days of that. They give you a booklet, and then after you're done, you have access to everything online. So all the videos, question banks, everything that you need to be successful.
Now, is that a free course?
Oh, no.
Oh, you have to pay for that?
You have to pay for that.
Okay, gotcha. So everybody pays for the Hearst course.
Yes.
You do this 3-day intensive course, and you get the books, materials, and everything. So Maddie, what do you do after that, like after those 3 days?
So those 3 days we actually took in October, I believe, and then we graduated in December.
Okay.
So it was after the 3 days, it was completely up to you. If you, like there were certain topics they didn't cover in the 3-day lecture, peds, maternity, that kind of thing, oncology. You have to go and watch the videos of that on your own.
Okay.
After, on the online resource that Renee was talking about, there's also documents on there reviewing, specific heart defects, that kind of real specific things that you need to know.
Okay.
And so after that, they give you test questions.
Okay.
And you have to take those on your own. So I know some people that we graduated with that after the Hearst review was over, never picked it up again.
Oh,
And then I know some people that, like us, that's what they used mainly to prep for the NCLEX.
gotcha,
So
gotcha.
it's very dependent on what kind of study person you are and if it's helping you or not.
I see. So it's not like you go to the 3-day class and then you just take the test right after.
Oh no.
So you have, like you said, you have some additional resources that you have to go through.
Right.
Okay, great. And so you did this in October, and I guess from October to now, you've kind of just been doing like a light study, heavy study, kind of what's been going on, because we're in March right now.
Okay.
not to say we, we're kind of moving there,
So for me, from October to December, I did a no study.
You did okay.
So I focused on precepting, which took up all of my time.
Okay.
Which is 12-hour days until you get 96 hours, plus a HESI exit exam that I had to prepare for that we can talk about later.
Okay,
So
gotcha.
I did a no study for NCLEX from October to December.
October to December.
I picked up NCLEX material again in January.
Oh, I see. Now, Renee, you I think you're missing out a key thing right here. Between that time,
I also had a beautiful baby boy.
that's right. You were actually pregnant during this time.
I was pregnant during this time.
Right,
yes.
right. And your son was born in January.
He was born in January.
Gotcha.
Yes.
And that's when you kind of picked up the studying.
Yes.
Okay. And then Maddie about to, well, I know you. So you started studying again in January as well?
Yes.
Okay, gotcha. So from January to now, you all have been basically using the resources that you got from the 3-day course?
Yes. And
Okay.
also UWorld.
UWorld. Okay, right. And UWorld is very good in terms of, you mean your question bank?
Right.
Yes.
Gotcha. And so I know last night we kind of talked a little bit about how to prepare for the questions, like
Right.
how to actually do multiple choice questions. And since you've been doing that, have you seen any change in how you're performing on your questions?
I definitely have seen a change, especially in my select all that apply, because I would always feel unsure. If I was unsure, if it had 6 questions, I would pick 2 that I was really sure about. And I'm like, it cannot only be 2 out of 6. So I would try to make something fit that didn't need to fit just because I felt like it needed to be more than just 2 questions.
Gotcha. That makes sense. That makes sense. So have either one of you ever gotten nervous before an exam?
Every exam for me.
For you, every exam. What
Now,
about?
now I'm the opposite, and they kind of made fun of me all through nursing school because I don't know really why, but right before an exam, it's just calm. I get really, really calm. I mean, I pray before every exam, so
Good.
maybe that's it.
There you go. Prayer
But
helps.
I get really, really calm before every exam, so much so that during the actual exam, I'm not nervous. Now, as
Good.
soon as the exam's over,
Right.
nerves
We
through the roof.
flipped.
Are you serious?
Because after the exam, I'm calm.
Mm-hmm.
Wow.
That
That
yin to the yang.
That is that yin and yang as well. That's right. So one of the things that I know I've told, and I don't know if I've told Maddie, but I know I've told Renee about this, is that typically whenever you do a question, and it's kind of what you're talking about, that calm during the test, because once you're doing a question, you're going to pick the best answer you know.
Yeah.
And I always say nobody intentionally picks the wrong answer, do they? So every time I used to take a test, I would think I got 100% when I finished. Now, I didn't get 100%, but I always felt like, look, if there was a better answer, I would have picked it.
Right.
So that's the same kind of thing. So awesome. So let's talk a little bit about, and I just want you all to tell me, give some advice to some pre-nursing students out there. Give us some advice to some pre-nursing students from each one of you.
So my top advice would be to find your study, the way that you study, and to find you a good study group, whatever your study method is, and it's different for everybody, but to stay that study method and stick with it. My other advice would be time management. You know, when I started nursing school, I was very, very busy. I was involved in a lot of extracurriculars. And then once I got in the program, I had to go back and kind of reevaluate and put nursing school first. Of course, not above your family or anything like that, but just using your time wisely, less slack off time, and more using your time in a purposefully manner.
I would say the same thing. Just be confident in yourself when you're applying. Like, even though you don't think about everybody else that's applying. Just think about yourself. Because when you think about there's 300 other people applying and I won't get in, just think about what you can do to help your chances of getting in. Like, don't think about everybody that you're going against.
That is awesome. Those are great words of encouragement. And what we do now, so with our traditional guest, we have this thing called Train Your Brain.
Okay.
And what we do is we give you a series of 7 words. And your goal after those 7 words, you cannot write anything down. You can't consult with one another. But after those 7 words, all you have to do is simply give us the first letter of those 7 words in order. So we call this Train Your Brain.
Uh-oh. My brain is inflamed.
All right, train your brain. Are you ready? So the 7 words, here are your 7 words. Cardiovascular, renal, folate, acid, vasopressin, phosphorus, umbilical. Who would like to go first?
CRA. CR.
That is Renee.
Yeah.
Okay, Maddie, you're up.
CRAP. Was there even a U word in there?
Oh, my
I don't know
goodness.
why- Did you say fistula?
Fistula. Oh, Lord, no. All right. Unfortunately, neither one of our guests are going to be winners today, but you are winners in life. And we're going to wish you the best on your NCLEX exam. And for just playing, we want to give you our MDI Prep. We're proud of you.
Oh, well, thank y'all.
So just because I know type A personalities want to know, what were those words again? They were cardiovascular, renal, folate, acid, vasopressin, phosphorus, and umbilical.
Yeah, I was way off.
I missed BP.
Again. All right. Well, thank you all so much for sharing with us. And we want to encourage anybody out there that's actually going into nursing school or applying to nursing school to listen to this podcast over and over again. There were some great pearls that they gave us today. And we wish you all the best on your NCLEX, and thanks for coming by.
Thanks for having us.
Let's talk